Hello, my name is Sarah Nazashuri, and today I will be doing a presentation on the patient perspective and what contributed to the situation and some potential solutions. So let's go ahead and get started. So the patient's story is that he is a Vietnamese speaking male, but speaks some English as a second language. The patient states he did not need translation services and that he speaks English well. So the provider had an English conversation with the patient. On a Friday, the patient's 5150 or 3-day hold was up, and since he was refusing to sign in on a voluntary hold status, the provider decided to place the patient on a 5250 hold. The provider told the patient in English that he was going to be placed on a 5250 hold to remain through the weekend until a discharge plan is in place. And the patient told the provider he understood. After obtaining that 5250 hold, the nursing staff went to officially advise the patient of the 5250 using Vietnamese translation services. And with those translation services, told the patient that they were on the 14-day hold. The patient became immediately upset and angry as he thought the provider told him that there were discharge plans in place and that he was leaving today. He states he did not know that he was placed on a 14-day hold and was upset at the thought of remaining on the psych unit for another 14 more days. The patient ended up escalating in behavior, requiring a code gray and emergency medications. So what domain fits this patient situation? The top one would be patient-provider communication. And patient-provider communication can be affected by differences in verbal or nonverbal communication styles. In this case, the patient was primarily Vietnamese speaking and the provider was English speaking. Minority patients tend to receive less health communication when compared to non-minorities, and this negative impact is increased especially when there are linguistic or cultural barriers. And having better patient-provider communication leads to the awareness of risky behaviors and health risks, understanding and then therefore adhering to a treatment plan, and it also helps the patient to make choices on their complicated health issues. So let's move on to the discussion. What were the contributing factors? One of them was that the provider did not use any translation services despite knowing that the patient's English was conversational at best, and even though the patient states that he knew English well enough not to be translated. Another contributing factor was that nursing had a blunt conversation with the patient regarding the 14-day hold. And another contributing factor is that the patient actually told the provider that he understands English enough to have a medical conversation and told them he does not need translation services. So what is a potential solution? So the solution to the provider not using translation services is that the provider should have used Vietnamese translation services to speak with the patient regardless of what the patient said, rather than rely on his conversational English. And this is because not using interpreter services when the patient has a limited English proficiency leads to a poorer quality of care. And oftentimes, even though English is conversational, it can be difficult to understand the nuances and the little details of what a provider is trying to say. So when in doubt, just use a translation service. And a potential solution to nursing just going right in, having a blunt conversation and telling the patient they're on a 14-day hold, what nursing could have done is they could have gathered the patient's understanding of the conversation with the doctor prior to advising him of the 5150. They could have asked the patient, hey, I saw the doctor just spoke with you. What did you get from that conversation? And do you have any questions? And that would have probably been a bit easier to approach the difficult conversation that they're going to have with this patient regarding another 14-day hold. So it's important to ask the patient what they know about this 5250 prior to advising. And lastly, a solution to the patient stating that, he doesn't need translation services. The solution can be to educate the patient when they arrive on the resources that the hospital has, which can be easily attainable, such as a phone or video translation service, so that the patient can ask for that when communicating with providers or nursing staff. And staff can continue to encourage the use of translation services. Okay, here are my references. And thank you so much for listening to this presentation on a patient perspective. Thank you.